Namaste. Greetings from Indraprastha Hospital, New Delhi. I'm Dr. Gaurav Kharya and I work here as a Director Center for Bone Marrow Transplant and Cellular Therapy. Today I'll brief you about the process or the procedure, the bone marrow transplant procedure we use to treat patients suffering from sickle cell disease. As you might be aware, sickle cell disease, the only curative option for this sickle cell disease is a bone marrow transplant. Now, once we have identified a patient with bone marrow transplant, this patient needs to be on some preparatory therapy for around 6 to 8 weeks. And then subsequently, after that 6 to 8 weeks of preparation, we take these patients up for bone marrow transplant. At our center, we have developed a very innovative protocol which is called as the Apollo protocol, which is sort of a reduced toxicity protocol which improves the overall outcome of these patients suffering from sickle cell disease. So these patients, once they are admitted for bone marrow transplant, they receive this Apollo protocol conditioning, which is given over a period of 6 to 7 days. Simultaneously, as these patients are receiving chemotherapy, the donor receives some medicine, which is called as GCSF, growth factor, to stimulate the stem cells out of his bone marrow and to bring them in circulation. Then roughly around day 0, which is day for bone marrow transplant, the stem cells are collected from the donor. There are 2 ways of collecting stem cells. At our center, we prefer a peripheral blood stem cell collection, which is just like any other blood donation procedure, a little bit different, but yes, it is done in the blood bank. The patient doesn't need to go to a theatre. Once we have collected the cells from the donor and the patient has received the conditioning chemotherapy, on day 0, which is considered to be the day of transplant, we infuse these stem cells just like the blood transfusion, and then starts the recovery period, which usually extends for around 14 days. This is called as the neutropenic period. This is a very crucial period because neither the old bone marrow is working here in this period, nor the new bone marrow starts working. So this 2 weeks period is very crucial, and the patient is very prone to have various complications such as chemotherapy related complications or infective complications. And for this period, patient needs to be very closely monitored for different complications, and the treatment for them need to be started preemptively. Now, roughly around day 14 post bone marrow transplant, the new bone marrow starts taking over. And how we can see this? Usually the bone marrow, the blood counts, which are rock bottom because of chemotherapy, they gradually start going up, and roughly around day 14, day 15, they cross a certain time point or certain limit, which defines the engraftment. Now, this is not over. Engraftment is a significant milestone, but subsequently this engraftment needs to be maintained. So these patients need to be on continued immune suppression so that we can maintain a harmony between the new system and the old system, and they don't harm each other. If the old system or if the recipient actually starts working against the graft, there is a possibility of rejection. Whereas if the graft or the donor system starts working against the patient, it can cause graft versus host disease. So these two are very important complications, and we need to balance out our strategies to sort of reduce or minimize the risk of both these problems, whether it is graft failure or graft versus host disease. Apart from this, another important complication is the risk of infections, various infections, bacterial infections, viral infections, fungal infections. So these patients, apart from being on immunosuppressive strategies, medicines, they are on regular antiviral prophylaxis, antifungal prophylaxis, and this prophylaxis continued for around 6 to 8 months, and gradually, as we wean off these patients of the immune suppression, the other prophylactic medications are also discontinued, and close to around 9 to 12 months, we try and discontinue all these medications, and subsequently these patients are sort of free of the disease and can live a normal and healthy life. Now you might be wondering that how do we decide the success of transplant? So to decide the success of transplant, there is a test, very specific test, which is called as a chimerism analysis, by which we test the percentage of functional donor cells in the recipient marrow. So this is called as a chimerism analysis. Our objective is to achieve a good donor chimerism, but sickle cell disease is one specific disease where even if we have a mixed kind of chimerism where approximately 80% cells are working from the donor, another 20% from the recipient, then also it's not a problem. If we can maintain this, these two systems can remain in harmony without harming each other. Thank you.